Hey, it's Dr. Khan from the ACL Academy, back with another deep dive to help you make sense of your recovery and crush this process. One of the most common questions I get is this: when can I start running after ACL surgery? But the real question you should be asking is, what has to happen before I run? So let's unpack that a little bit. Before I do, guys, if you've been following along with the YouTube channel, please give this video a like. Subscribe to the channel and share with a friend. Running too early or without meeting the right criteria can lead to setbacks, swelling, and even re-injury. So in this video, what I'm going to do is I'm going to walk you through exactly what needs to happen before you're cleared to run. So let's get into that. Number one, I want you to know timeline really isn't everything and doesn't dictate the recovery process and the progressions. A lot of people think, oh, I'm at 3 months. That means I can start running because a piece of paper, a protocol says that they can. But here's the truth. Time alone does not equal readiness. You need to earn the right to run by hitting certain checkpoints. Otherwise, guess what? You're just guessing. And I've worked with people who were cleared at 12 weeks and looked solid. And also I worked with people at 20 weeks who just weren't ready yet. Everyone's recovery curve is at a different level, and it really depends on how they respond to the rehab process. Number two, what needs to happen before you run? So let's break this down a little bit. I'm going to talk about the main things that I look for before I start people on a return to run progression. Number one, that starts with full range of motion. We are looking for symmetry. So whatever your healthy leg does from a straightening and a bending standpoint, that's exactly what I'm looking for. If you're lacking terminal extension, your gait will be off, and that's guaranteed. Number two, I'm looking for swelling to be basically down to nothing. And this includes during rest as well as after activity. Your knee needs to tolerate everyday stuff such as walking and stair climbing before we even get to running. So if you're still icing daily or dealing with reactive swelling, you're just not ready. Number three, probably the most important, is solid strength, and we need to test this objectively. This is a non-negotiable. What I look for is 80% quad and hamstring strength symmetry compared to the other leg before impact loading begins. How we do testing here at the ACL Academy virtually is we send our clients into a gym, then a knee extension machine, a hamstring curl machine, and a leg press. We do what we call a 1 rep max test. Basically, I'm looking to see what's the max amount of weight you can lift on your healthy leg for 1 rep, and then I test the surgery side. We take both of these numbers, we divide them into each other, and it gives us a percentage. We are looking for an 80% cutoff. And then after you clear all these things, such as full range of motion, no swelling, 80% strength, you don't just go out there for a jog. We need a structured plan. So we start everybody on a walk jog progression. And this is done on a treadmill because we can control the environment, we can control the speed. And what we are then doing is building duration intensely over time, while monitoring how the knee responds. Most importantly, what we have to do is, especially the first couple runs, you will be very tentative, you will feel wonky, you just won't feel right. So it's important to get a couple runs under our belt, walk runs rather. And then at that point, we will then do a gait analysis. We will video the client from the side and from the back, make sure that they are stepping with a symmetrical pattern, make sure that the cadence or the steps per minute looks good. We're watching the knee flexion angles when that leg is the stance leg. These are the main components that we want to make sure that we're not developing compensations early on, because as we progress through the running progression, we don't want to have a compensation that continues on, because that will be hard to work ourselves out of it. So my running progression at the ACL Academy is 11 different levels. Starts with a very, very basic walk jog and finishes at a 3-mile progression. And it is important that everybody going through this process does go through some capacity of the running progression, because it's important for the knee to tolerate that impact. If you skip these steps, I've seen people rush this stage and pay the price. They start running because their PT said it was time, or their protocol said it was at this time they can run, or maybe they even went to their surgeon's office visit for their 3-month follow-up, and their surgeon cleared them based on nothing. And what happens when you run when you're not ready? Well, you're going to run with bad mechanics, maybe build even a limp into your running pattern. And worst case, you can get flared up, not only to the graft, but also other parts of the knee. And this is just not worth it, because if you take steps back like this, it's going to be hard to push forward. The take home, guys, running is a privilege, not a right. So earn it. Put in the work. Progress your strength, monitor your movement, and have a plan. It's very, very important that you check off all the boxes before you do a running progression. Here inside the ACL Academy, we help people go from post-op to powerful, and that includes a full return to running blueprint when the time is right. We guide you step by step with a criteria-based progression and full support. So if you're in that middle phase, 3, 4, 5 months post-op, and you're just not sure if you're ready to run or how to build a plan around it, let's talk. Check the link in the description to apply for ACL Academy and set up a call with me. If this video helped you, drop a link, subscribe, and share it with a fellow ACLer that needs to see these videos.